it's Dr. Dumestre, and I'm going to go through the recovery time period and restrictions following a DIEP flap after double mastectomy, preventative versus cancer mastectomy. The main differences would be just if you had other treatments that can further extend your recovery time, such as chemo or radiation. In a preventative mastectomy, you're not going to have any of those factors. So assuming there's no additional treatments, you're just doing the DIEP flap. So as far as preparation, like I mentioned in my other recovery videos, it's really just in the weeks leading up, making sure that you have enough protein intake, 0.5 gram to 1 gram of protein per pound of body weight, that you're eating a well-rounded diet, and that you are building your strength. So especially when this is done in the preventative setting, building your leg strength, as that will help you out a lot post-operatively. Then as far as the activity and recovery, starting in day 1. So for my patients, I keep them in hospital for 3 nights after this surgery. Day 1 after surgery, the nurses remove your Foley catheter, your P catheter. They get you out of bed, up to the chair, and up to the bathroom. Day 2, you are already being seen by PT. They're getting you out of the room, walking you up and down the hallway. And then typically on day 3, assuming you're doing well, then you are cleared to go home and they help you with your first shower before you get home. Once you're home, those first couple weeks are the worst of it. You will be walking in a hunched, slightly flexed position, usually for the first week or so, given I've removed all of that lower belly, skin, and fat to reconstruct the breast. You'll want to be in a flexed position for sleeping, so that can be a recliner, a movable bed, or building yourself a whole construct with wedge pillows for the back, pillows under your knees to keep yourself in that bent position. Once you're home, even though you are sore, you're tired, I still make sure that you're up every hour or so while you're awake. Quick little walk around the house, that keeps the circulation pumping in your calves, prevents risk of blood clots. Usually by the end of the 2nd week, patients are feeling a lot better. So you are typically off all of your pain medications, maybe just taking some of your nerve pain medication. Your energy's starting to get a bit better and you're now up and moving a lot easier. As far as the restrictions, I don't want you lifting, pushing, pulling anything over 10 pounds for the first 2 months, and no strenuous exercise. So in this time period, you are building your stamina with longer and longer walks. You're working with physical therapy to regain shoulder range of motion, to stretch out the belly, and to do lymphatic massage to start clearing that swelling. Then after 2 months, you no longer have any activity restrictions. You can start getting back into your usual activity routine, knowing that things do take time to re-strengthen and things feel sore the first few times that you try to engage and work out your abs. As far as return to full energy levels, so you feel back to baseline, I would say on average takes about 3 months following the surgery. As far as garments go, I have you wear belly compression for 2 months following the surgery. That can be a binder or a panty with an extension like a Spanx type. You will be in a bra also full-time day and night to protect the breast reconstruction for a period of 6 weeks. As far as complications, so when you're getting a DIEP flap, it is fairly high risk to have at least one area somewhere break down. For the little wound, something like that is the most common. Anything more major is less common. So you may also be dealing with that throughout your recovery, and that's usually just a daily wound care that you'll be doing after your showers. Return to work, I usually recommend that patients take 6 weeks off for this surgery. If taking time off is a big issue for you, at the earliest, I would suggest 4 weeks. I mean, this is a big surgery, both emotionally, physically, and it's nice to take that time just to focus on your recovery, rebuilding your stamina. Hope that helps. Have a great day.